Xin kính chào quý vị. Vào ngày 17 tháng 5 năm 2013, chương trình bài trừ bệnh siêu vi gan B thuộc thành phố
The
Washington
Hepatitis
DC
B
đã
Initiative
tổ
of
chức một buổi
Washington,
giảng
D.C., also known as HBIDC, hosted its third annual benefit gala and awards dinner. Be the voice for Hep B awareness, one of many events for National Hepatitis Awareness Month in May. The event took place on Friday, May 17, 2013, at the China Garden Restaurant in Arlington, Virginia.
I want to get to some of our sponsors as well. First off, our platinum sponsor, Pro Healthcare Servicing, a home healthcare agency. I believe they're in one of the head tables here. So if you get a doctor tonight, you know that table over there. And also our many silver and bronze donors as well. So thank you for your ongoing support. Chan, Virginia Chan, Lauren Kim. You ladies do.
Ms. Jane Pan, HBIDC's executive director, said that this was an opportunity to honor the so-called voices of the HBIDC, to celebrate its accomplishments, and to strengthen its fight against hepatitis B.
We continue to do education and screenings and vaccination, and also refer to those people who tested positive to care for throughout the years. And last year, in 2011 to 2012, we educated more than 4,000 people and screened more than 2,000 people and found 169 people tested positive with hepatitis B, and we also continue vaccinating them. 26% of that population was needed vaccination. We have a very effective vaccines that we can protect people from getting infected. It's a very safe, effective vaccine.
It's well known that hepatitis B is a serious liver disease. In the United States, 1 out of 10 Asian Americans is infected with the hepatitis B virus, many of whom are not aware of it. Untreated, hepatitis B can lead to liver cancer, and it has been known as a silent killer.
BIDC was founded because our founder lost her brother and her mother in 3 years' time while her brother was going to college. And they didn't know. Because they didn't know, then that's what happened. If they would have found out beforehand, if they had done screening beforehand, this would not have happened. That's how it was founded by Leslie Hsu, by a lady called Leslie Hsu.
8,000 residents of Fairfax County. He served in the seats since
Ms. Carolyn Wong, chair of the board of directors of HBIDC, shared the sources of funding for the Hepatitis B Initiative of Washington, D.C.
We have several sources of funding, and what we do is we primarily rely on the goodwill of the community. We are out there in the community educating them about hepatitis B and screening them to ensure that they can protect themselves and their families. And so we rely on events like the gala tonight to bring people together that are supporters of our initiative. And that's where we get primarily most of our funding, as well as government support. For example, the mayor's office, the Asian Pacific office with the DC mayor, has provided grant funding for our programs. We also work closely with universities like the public health school with the Johns Hopkins University to do research and educate other lay health workers. So we require a lot of effort and coordination to bring everyone who's interested in working together to address this serious disease.
Ms. Wong also talked about last year's activities and the future plans of the HBIDC.
Oh, we're so excited. We have made great strides in the last few years. So, for example, we started out in the Northern Virginia area with the Korean American churches. We went to Chinatown in D.C. and had our screening and vaccination events there. We just last week we were in the Burmese community in the Baltimore area. So as we are reaching out to the different targeted communities, they are learning more about the seriousness and how they can protect themselves against hepatitis B. As long as we have the funding to do so, and of course the help with your organization in getting the word out to the community. So if any of your community leaders are interested in starting a screening event and vaccination event in your communities, please call our Executive Director, Jane Pan. She'd be more than willing to begin to work on planning that event.
Dr. J. Nadine Gracia, the keynote speaker at the event, is a Haitian American, currently the Deputy Assistant Secretary for Minority Health and Director of the Office of Minority Health at the U.S. Department of Health and Human Services. This fact shows the importance of tonight's Be the Voice for Hep B Awareness benefit gala and awards dinner.
For him to be out in the community, raising awareness, talking about hepatitis, he saw his responsibility.
When asked if the federal government is supporting the HBIDC and in what ways, Dr. Gracia said,
Hepatitis B Initiative of Washington, D.C. is a very important organization, really helping us in our efforts to combat the silent epidemic of hepatitis B. The Hepatitis B Initiative of Washington, D.C. has recently actually received a grant from Hep B United, a project that the Office of Minority Health has supported that is led by the Association of Asian Pacific Community Health Organizations to raise awareness of hepatitis B, increase testing, and provide linkages to care.
Dr. Gracia also noted the HBIDC's contributions to the Asian American and Pacific Islander communities.
Well, hepatitis B certainly has a disproportionate impact on the Asian American and Pacific Islander population. We know that 1 in 12 Asian Americans and Pacific Islanders actually have hepatitis B infection, and that's almost half of the hepatitis B cases in the United States, where Asian Americans and Pacific Islanders represent just only 5% of the U.S. population. So there are truly disparities in hepatitis B.
Dr. Gracia was also asked what the Asian American community and the healthcare experts should do to close the gap of these disparities in terms of healthcare in the Asian community. She said,
So certainly raising awareness about hepatitis B and really promoting prevention and testing and screening for hepatitis B and access to services and health care. But we also know providing culturally and linguistically appropriate care and services for the Asian American and Pacific Islander community is also very important, because sometimes it's not only a lack of access to care, but it's also the cultural and linguistic barriers that may exist for the Asian American community. Well, because of the Affordable Care Act, the health care law that was signed by the President 3 years ago, we really are working to make health care more affordable and provide better access to care. Now, because of the law, for example, adults are able to get hepatitis B vaccination at no cost, and that is a tremendous opportunity to really work towards preventing and fighting against hepatitis B. So it's important that individuals in the community really contact their local health department to see what services are available. There are also many community-based organizations like the Hepatitis B Initiative of Washington, D.C. that is working to support communities in raising awareness, testing, and so contacting those organizations to find out what services are available are very important for individuals living in the community.
The next award goes to Dr. Santran. Dr. Santran runs the most attended health fair in the nation. At the last health fair, we've seen 617 people for hepatitis B and hepatitis C. 8.75% tested positive.
Dr. Sang Tran presently serves as the president of the Vietnamese Medical Society of Northeast America. He was one of the awards recipients at tonight's event. In past years, he organized several health fairs for the Vietnamese community in the Washington, D.C. metropolitan area. He was honored and thanked for his fervent commitment to the community. Dr. Sang explained the reason for his support of the HBIDC.
Well, in the past few years, the Vietnamese Medical Society of Northeast America has contributed a lot to the SBI DC because we combine the forces to do the screening every year. I think the SBI DC only joined us for the last 2 years and has been helping the medical society to organize very big event every year called Summer Health Fair. And usually we screen over 500 people every year, and the number of attendees for the health fair usually about over 1,500 people every year. With different services beside the screening for FBSC, we have the services to bone density, hearing, for vision check, and also for community services like welfare and security, and helping with the tax as well.
Dr. Motley is a pioneer of the hepatitis B world. We are here because of Dr. Motley and his team. We have had many adventures together, from being two Chinese people reaching out to the African communities, to the House of Delegates in Annapolis, Maryland, where with the help of CCACC, 2 busloads of people lined up at the balcony.
Dr. Mark Lee, the former president of the Chinese American Physician Association, was another awards recipient. He shared about his organization's contributions to the HBIDC.
I essentially working with the Asian Association of Chinese American Physicians. I used to be the president. Now I just resigned from that. But through this organization with Chinese physicians, we have worked with many projects. Notably, there's several. Number one, that we invited to the Senate and invited to Congress to do advocacy work and get recognition by the highest level of government. We also went to the USHS, also the programs. In addition, we started the project in the African newcomers by a project in the Chinese embassy, where there are many African ambassadors come along to join us and help us. In addition, we went to Annapolis and have hepatitis B bill passed in Maryland. They have done a tremendous job. They're all volunteers, as you know, and with very limited funding. But their compassion and their hard work and their expertise has helped bring this into the open and get recognition by the highest level of the government to address this issue.
Will you continue to support them?
Of course, we are always partners. As I say all the time, together we can.
Of fighting a deadly disease that is often not talked about. Hepatitis B infects 1 out of every 10 Asian Americans seek treatment as well. HBIDC, as you heard Julie mention, is the only organization in the DMV dedicated to eradicating this disease and its deadly consequences. The group works to educate people, and the organization helps link them to care so they can be treated right away. 8,000 residents of Fairfax County. He served in the seats since 2009, when he became the first Asian-born immigrant.
We noticed that there was a large crowd at tonight's gala, and the attendees included government officials, medical professionals, and people from the community. Ms. Julie Koo, the executive director of the Executive Office of the Mayor's Office on Asian Pacific Islander Affairs, shared some thoughts on the work of HBIDC.
Yeah, so HBIDC has been around only for a short time, I mean, at least in DC area, they've been around for a long time, but the work that they have been doing, they have made so much impact in like short time period. They definitely did a lot of great work in increasing awareness about Hep B in the city and also I think the greater Washington DC area.
In addition, she said that her office has been supporting HBI-DC.
Yeah, so Hep B and the leadership through Jane Penn, and there are so many different volunteers and doctors who've been working and supporting, the board members supporting Hep B, we were able to give them some funding to sustain their work in DC. So it's not a lot of money, but we were able to do that for I think a couple of years, and this year they are also one of our grantees. Definitely, Mayor Vincent Gray also has issued a proclamation to make sure to commemorate the Hep B Awareness Month and also to commemorate the work of the Hep B organization has been doing in the city. So definitely, this is a great leadership, a great organization with so many different volunteers. So we're really happy to work with this organization, and we'll continue to work with Hep B, Jane Penn and the leadership of Hep B to make sure that increase the awareness of Hep B in the city and also continue to do the screening. We have been supporting, even though it's not a lot of money, but also there are other part of funding available, like for example in the Department of Health and other organizations. So we're working with them also try to get some funding for this initiative as well. I think that it already has done a lot of work in increase awareness of Hep B, and there are other issues about also Hep A and C too. They are sort of kind of involved in that as well. I think that continue to do the screening and continue to really increase awareness in Asian American and Pacific Islander community will make greater impact, and I think even nationwide. I think this will really make a role model, and it's sort of showing as like a great example to continue this type of initiative to make sure that people really understand about Hep B.
Introduced and actually got House Joint Resolution 724 passed in Virginia. We don't came to leadership and
our special guests, something that will probably eradicate things along with.
This January, Delegate Mark Keim introduced House Bill 724, which designated May 19th as Hepatitis B Awareness Day in Virginia. The Virginia House of Delegates unanimously passed the bill. Delegate Mark Keim was also the guest speaker for tonight. He explained the reason for his introducing the bill.
I was pleased to introduce and also have the House of Delegates and the Senate of Virginia pass the resolution that designates May 19th as World as well as Virginia's Hepatitis Awareness Day. And the reason why we did this is because so few people understand how our health is affected by hepatitis B, especially for Asian Americans. It's a very, very deadly disease. We have 1 out of 10 Asian Americans that are impacted by it, and very few people understand that. So by having the government announce that we're going to be aware of this and make sure that we do events just like this one to introduce the world and to Asian Americans about how important it is for us to be screened, to be tested, and if you have a problem, then to be seeking treatment, that's very important to save lives. I think the Hepatitis B Initiative of Washington, D.C. is a tremendous organization. It is doing something that nobody else is doing, which is make sure that we're aware of this. But more important than being aware, they're actually taking medical steps to make sure that everybody that is able to gets a screening, a blood test, and then if there's any positive concern there, that we want to make sure that they're seeking treatment. Because the good news with hepatitis B is that once it's been detected, there is a treatment for that. There's not a cure, but there's a way that you can make sure that the symptoms aren't going to be worse. And so if anybody's suffering from that, we want to make sure that they understand that there is a treatment. And that's what Hepatitis B Initiative of DC does. The government is asked to sponsor a lot of different initiatives, including HBI, but a lot of other initiatives as well. As you know, HIV, AIDS is still a very concern, cancer, and many others. So we're going to try everything we can in the state of Virginia to seek some kind of financial assistance from the state. But ultimately, it has to be a word-by-word community, and organizations and media does a great job in explaining the concerns that we have. So I think for more important than the funding is the awareness, and make sure that people understand and talking to each other and be screened. There's nothing to be afraid of. You should be screened.
Mr. Duan Hu Dinh, the president of the Vietnamese community in Maryland, Virginia, and Washington, D.C., shares his thoughts about the work of the HBI-DC.
People of Virginia, Maryland, and D.C. to get some free consultation about Hep B. That's what it really counts. That's why we are here to help and be with HBI-DC.
There was a silent auction and a music performance that showed various cultures of the Asian American and Pacific Islander communities.
First off, our platinum sponsor, Pro Healthcare Servicing, a home healthcare agency.
Mr. Sebastian Graham, the Director of Strategic Planning of the Pro Healthcare Servicing LLC, the platinum sponsor of the fundraising gala tonight, talked about his involvement of the HBIDC.
We got in touch with HBIC last year. It was actually last year that I met with Dr. Benson Yu, who is a very, very concerned physician serving the Asian population here in Fairfax. So he invited me to his office, and then one evening we started talking, and then he asked us if he would be willing to contribute, and then we started contributing. So this is the second time that we are supporting this very serious challenge. Other people can get involved by awareness. We have to create an awareness in the community, and also there should be strong advocacy for this very challenge. And so as we go around as a senior serving professionals like Pro Healthcare, we go out there to the communities. We deal with doctors like Dr. Yu. I go to Dr. Yu, I go to other doctors. And so as I engage and interact with them, they tend to share with me things that affect seniors, especially in this very arena, the hepatitis B that affects the Asian Americans. We go out there and share, and then we also educate the people in the community. It's a concern for all, and we have to care for one another. So there should be strong advocacy. And like myself, as I leave this very gathering tonight, I will continue to share and inform the people that I come across, because like AIDS, this is also a serious disease that we should all help eradicate.
I am the president of the National Task Force for hepatitis B throughout the country. In Washington, D.C. is one of our associates that we work together locally to promote education hepatitis B and also to help with hepatitis B advocacy. HBIDC is a very important organization locally. I have been collaborating with Jane Pan, who is a fabulous executive director for the program, and she has been working with different communities to reach across. She reaches across all different minority groups, the Burmese, the Vietnamese, the Chinese, the Korean, which is the same goal that we have nationally. So this is a very good representation for our activity locally and nationally.
Dr. Jake Liang, Chief of the Liver Disease Branch and Director of NIH Clinical Center Hepatology Service from the National Institute of Health, expresses thoughts and support.
My name is Jake Lian. I am the Chief of Liver Diseases at the National Institute of Health. I don't really have any role at the HBDIC because I'm just here to support the program, but we do a lot of research, policies, guidelines, and we're trying to advocate for the treatment, diagnosis, and management of hepatitis B. And so we're working together with a lot of the doctors here trying to make sure hepatitis B is an important problem to address. And I think we're making a lot of advances, and really this is really a collective effort from everybody, not only from the researchers, policymakers like us, but also from clinicians and community activists and the patient advocacy group to do this, because it does take a village to conquer the hepatitis B virus.
Because of your support tonight, we are able to deliver life-saving service with very little.
The Gala of the Hepatitis B Initiative of Washington, D.C. was quite a successful event. In particular, it gave the attendees an optimistic feeling and a greater confidence in the future activities of the HBIDC.
Lâm Kim Thu, tường trình từ Arlington, Virginia.